تمام.
Plastic model, frontal belly muscle, orbicularis oculi muscle, orbicularis oris muscle, and here is the maximotor muscle. Notice this artery. This is the facial artery, and it has branches here on the face, inferior labial, superior labial, lateral or external nasal, and on medial side here you will find angular artery. Notice its tortuous course, and here you can feel its pulsation anterior inferior to the masseter or 4 centimeters from the angle of the mandible. This is the anterior facial vein. Here is the supratrochlear nerve vessels, and here supraorbital nerve vessels. This superficial temporal artery by its branches, anterior posterior, superficial temporal vein, auriculotemporal nerve, temporal branch of the facial nerve, zygomatic branch, buccal branch, and mandibular branch, parotid gland, and parotid duct, transverse facial vessels. This is sternocleidomastoid muscle, and on its outside here you will find the external jugular vein. Tributaries of the internal jugular vein. Posterior division of retromandibular vein united with posterior auricular vein to form the external jugular vein, plus transverse facial vein here, and posterior external jugular vein, and often the occipital veins. All these are tributaries of the external jugular vein that ends into subclavian vein. This is sternocleidomastoid muscle. This point is called Erb's point. 4. Transverse cutaneous or transverse cervical nerve of the neck, great auricular nerve, lesser occipital nerve, and 3 branches of supraclavicular nerve, anterior, middle, and posterior. This is the trapezius muscle, and this is the posterior triangle. If we have a look here, this is the anterior belly of digastric muscle from digastric fossa, communicating by common tendon with the posterior belly of digastric muscle. Notice also different in the facial or in the nerve distribution for this muscle: posterior belly from the facial nerve, anterior belly from nerve to mylohyoid from the mandibular nerve. Muscle close to the posterior belly is called stylohyoid, that its tendon divided in 2 parts and enclosing the posterior belly of the digastric muscle. Submandibular salivary gland. Notice here the facial artery that grooving the posterior part of the gland and supplying the submandibular salivary gland. This is the mylohyoid muscle. This is submandibular triangle or digastric triangle. Here is the muscular triangle. Notice the presence of muscle. This is sternohyoid muscle from the sternum to the hyoid bone and the greater cornea. On its lateral side, you will find superior belly of omohyoid, sternohyoid, sternothyroid, superior belly of omohyoid, inferior belly of omohyoid. All these muscles are strap muscles supplied by ansa cervicales. Notice here the external carotid artery. Branches of the common carotid artery, bifurcation of common carotid artery at the level of upper border of thyroid cartilage, dividing into 2 terminal branches: external, that's anterior here, and posteromedial. You will find internal carotid artery that continues in the carotid sheath. From the anterior surface of external carotid, you will find 3 branches. First branch is called superior thyroid artery. Second branch is called lingual artery. Third branch anterior is called facial artery. Termination inside the parotid gland by maxillary artery and superficial temporal at the level of the neck of the mandible. posterior surface giving two branches, occipital and posterior auricular. Medial surface giving only one branch called ascending pharyngeal artery. This is the end of this specimen.